NBC News Now correspondent Maura Barrett at a nurses' strike in Langhorne, Pennsylvania. Maura, this is the second day nurses are striking outside St. Mary Medical Center. What are they asking for, and what is the hospital saying?
Allison, the nurses are looking to draw attention to what they say are dangerously low staffing levels here at this hospital, and they're calling it a microcosm for what we see across the country. These nurses are risking their lives going to work every day, treating COVID patients, and they're asking the hospital to hire more staff and also work to retain them better. This hospital in particular has lost 250 nurses in the last year, 40 alone in the last month or so. And it's very concerning as we're going into the second wave. They're tired, they're fatigued and exhausted from this never-ending pandemic, it seems. And I want you to listen to what they describe as a typical day in the life as a nurse during this pandemic.
A typical day in the life of the hospital is a nurse that is overburdened with patients. We don't have enough nursing assistants. We don't have enough housekeepers. And the nurse has become the unit secretary, the housekeeper, the aide. And it's just not fair to the patients. It takes away from patient care.
We have lots of concerns about being able to staff the hospital properly. COVID compounded that problem because it takes probably double the labor to take care of a COVID patient with all the PPE and all the other things you have.
And at the end of the day, we leave exhausted and unfulfilled because, this is a principal matter for us. These suits, they see these people like widgets. They run it like a corporation. These people are not widgets. They are our community members. They are people that we walk among.
You leave exhausted wondering, did I do the right thing? Did I do enough? Did I help? And that's not a good feeling when you're leaving the hospital and you feel like you didn't do enough.
I don't know if you have any.
As for the hospital and the overall company that owns the hospital, they've been in negotiations since before the pandemic started. It actually stopped during the first wave, and the nurses said that they wanted to settle everything out before the second wave. And so I reached out to Trinity Health Systems. I want to read you part of the statement they sent back. They expressed concern that nurses are striking at this moment when we're seeing the second wave. But they said PA-SNAP, the union that represents the nurses, and St. Mary's bargaining committees had some productive dialogue around staffing, but we believe the main sticking point was wages. The bargaining unit members went ahead with their planned strike on November 17th, and we recognize their legal right to do so. Now, on that note on wages, several nurses telling me their former colleagues actually went to other hospitals in the area simply because they would make $6+ an hour at those other hospitals. So they're asking the hospital to level up their pay, especially as they're getting ready to tackle this second wave.
Maura, let's talk about what else is going on in that state. Pennsylvania reporting over 6,000 new COVID cases today. How is PA trying to get this under control?
Yeah, an absolutely staggering number, Allison. It's almost triple or quadruple the peak of what we saw back in the spring. So clearly very concerning. The governor and the Secretary of Health here saying that they're actually going to they enacted stricter mask requirements. So there's already a statewide mask mandate, but now it is required whether you're inside or outside with anybody that's not in your immediate household. So a lot of concern when it comes to that, because that is obviously the main way we see the spread. The other new action they're putting into place is that anybody that travels outside of Pennsylvania and wants to come back needs to have a negative test within 72 hours or quarantine for 14 days.
All right, Maura Barrett in Pennsylvania, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.